Hello, and welcome to the eMedNY computer-based training series for New York State Medicaid providers. This video is part of our pharmacy series of tutorials. The purpose of this session is to familiarize providers with the New York State Medicaid Pharmacy Program, NYRx, billing medical supplies. Medical supplies may be provided by a pharmacy. Pharmacies must have category of service 0441 or 0441-0442 to provide medical supplies. It is recommended that providers be familiar with the specific policy and procedure or medical supply code manual and reference it for specific information on coding and other provider-specific information. Please note that pharmacies that choose to bill via the professional or medical claim format need to be enrolled and have a Medicaid category of service of 0442 assigned to them. Medical supplies for pharmacies can include enteral and parenteral therapy, medical surgical supplies, hearing aid batteries, vaccinations, diabetic supplies, and family planning. Guidance on the Medicaid pharmacy program's coverage of medical supplies can be found on the New York State Department of Health's Pharmacy Scope of Benefits webpage found at the bottom of the screen. To find information about medical supplies, go to the eMedNY website at www.emedny.org and click on the Provider Manuals tab along the top of the page. On the Provider Manuals page, scroll down the alphabetical list to the Pharmacy Provider Manual. In the Pharmacy Provider Manual, information about medical supplies is found in the Medical Supply Code section and the Preferred Diabetic Supply List, PDSL, found on the Magellan website. Let's start by going to the Preferred Diabetic Supply List. From the NYRx Magellan website's Preferred Diabetic Supply Program page, click on the Preferred Supply List link. A PDF document containing the NYRx Preferred Diabetic Supplies list and a fact sheet with additional information and resources will open. In this example, we see Freestyle Light test strips with the NDC, National Drug Code number, of 9907-307-0822. Information regarding the Preferred Diabetic Supply Program is also available on the NYRx Medicaid Pharmacy Program website under Information for Providers. Scroll down to the Medical Supplies section to access the Preferred Diabetic Supply Program information. You will also find a link to the document listing related medical supply codes billed via NDC. Select medical supplies, including pen needles, syringes, and lancets, may be billed on a pharmacy claim using either the product's 11-digit NDC number or the 5-digit procedure, also known as HCPCS code. Refer to the pharmacy list of reimbursable drugs found on the emedny.org website for pen needles, syringes, and lancets reimbursable through the NYRx program. When submitting claims in the NC-PDP D.0 format, Preferred Diabetic Supplies will be billed with NDC numbers using the correct qualifier. As previously mentioned, NDC numbers are available through the Preferred Diabetic Supply list on the Magellan website. When submitting a Preferred Diabetic Supply Program claim with an NDC number in the NC-PDP D.0 format, a qualifier of 03 must be entered in claim segment field 436-E1 with the applicable NDC number entered in claim segment field 407-D7. Returning to the Pharmacy Provider Manual page on emedney.org, additional information about medical supplies is found in the Medical Supply Codes section. The Medical Supply Codes table of contents shows several different sections. Clicking on any of these options in the table of contents will bring you directly to that section. The Pharmacy Medical Supply Codes Manual includes sections for general information and instructions, enteral and parenteral therapy, medical surgical supplies, hearing aid batteries, and pharmacists as immunizers. Pharmacies are able to bill procedure codes, also known as HCPCS codes, found in the Pharmacy Medical Supply Codes Manual via the NC-PDP D.0 format using a specific qualifier to identify a procedure code. NDC numbers are not typically used for billing most medical supply items, except for select medical supplies and those subject to the Preferred Diabetic Supply Program discussed earlier. When submitting a medical supply claim with a procedure code in the NC-PDP D.0 format, a qualifier of 09 must be entered in claim segment field 436-E1 with the applicable procedure code entered in claim segment field 407-D7. Procedure codes found in the Medical Supply Codes section may require prior authorization. We're now going to introduce the three most common types of authorizations for pharmacy claims: the Dispensing Validation System, DVS authorization, IVR Enteral Web Portal authorization, and prior approval. If a procedure code has a pound sign or hashtag, as in this example of B4088, the procedure code requires a Dispensing Validation System DVS authorization. If billing NC-PDP format, a DVS is authorized when a claim is submitted and approved for payment. If billing professional format, a DVS authorization is required either through ePaces or the HIPAA-compliant 278 DVS transaction. A PA code of 6 in the medical supply fee schedule also indicates a DVS authorization is required. If a procedure code has an asterisk, as in this B4150 example, the procedure code requires a prior authorization through the IVR, Interactive Voice Response System, which is processed through the telephone, or by the Enteral Web Portal located on the emedney.org website, or directly at medicaidenteralportal.health.ny.gov/portal. Prescribers, ordering providers, will initiate the authorization, and dispensers, pharmacies, DME providers, will activate the authorization and include the authorization number on the submitted claim. A PA code of 4 in the medical supply fee schedule also indicates an enteral PA is required. If a procedure code is underlined, like this B4224 code, the procedure code requires a prior approval. Prior approval can be requested on a paper form, the eMedney 361501, the prior approval request function on ePaces, or by submitting a HIPAA-compliant 278 PA transaction in your software. A PA code of 1 in the medical supply fee schedule also indicates a prior approval is required. NYRx medical supply billing exceptions. Claims for diapers, underpads, and liners must be submitted through ePaces, the HIPAA-compliant 837 professional format, or on the eMedNY 150003 paper claim form. Diapers, underpads, and liners cannot be billed through the NC-PDP format. Similarly, DVS authorizations for diapers, underpads, and liners must be requested through the 278 DVS or ePaces and are not available through the NC-PDP format. Prior approval is required for two procedure codes, A4335 and T4543. The list of diapers, underpads, and liners found in the Medical Supply Codes section of the Pharmacy Manual shows the procedure codes with pound signs, hashtags, or underlined, descriptions, and quantities. Medical supply claims submitted via the NC-PDP D.0 format with some NDC numbers could deny. The exceptions being select medical supplies and preferred diabetic supplies mentioned earlier. In these situations, medical supplies should be billed using procedure codes. If one of these medical supply claims is submitted via NC-PDP with an NDC number instead of a procedure code, the claim will deny for NYRx edit 00218, provider not approved for service, and with an NC-PDP reject response of 6Z, provider not eligible to perform service, dispense product. For additional information regarding the billing of medical supplies, please contact or refer to the New York State Medicaid Pharmacy Program, NYRx, the Preferred Diabetic Supply Program, Magellan, the Enteral Formula Prior Authorization Dispenser Worksheet, the web portal for enteral authorizations, and eMedNY. This concludes our billing medical supplies tutorial. Thank you for joining, and please visit us at www.emedny.org for additional training resources.